Let's talk about the lower eyelids because this is an area that we are drawn to in terms of our eye seeing a person in front of us. And the lower eyelid changes that occur with age, the bulging and the contour changes that occur, project a fatigued, tired appearance to us that we then register and believe that the person is tired and fatigued, and yet they may not be. They may feel full of life and full of energy. So I've treated many, many patients with lower eyelid bags. It's an area that could be easily remedied. And today we're going to dive into why we develop these bags and the non-surgical and surgical treatment options that are out there. So what's actually happening to our lower eyelids over time? Yes, in our 20s, most of us don't have any hills and valleys in the lower lid, no deep circles, no darkening of the lower eyelid. But by the time we're in our 30s, we're starting to see some of those changes that are occurring. And what is exactly happening? It's a complex array of different problems that are occurring. One is there's a laxity of the skin. The skin starts to lose some tonicity, and some of the collagen and elastin in our skin, even in the lower eyelid, where the sun rays beat down on our lower lid, in particular compared to the upper eyelid, there are changes that are occurring there that cause laxity of the skin, and that's one factor. The second factor is volume changes. Volume, meaning fat in particular, is changing. So there's some fat atrophy, there's shifting of fat bulges that occur that can be due to either the fat coming forward passively from behind the eye, causing bags, slight bags in the lower eyelid in our 30s, or sometimes there's actually kind of a hollowing effect due to the atrophy of fat or shifting of the fat downward. In addition, there are skeletal changes that are occurring. The bone acts like a structural support for our soft tissues or our face, and those bones are actually changing with time also. The eye sockets are getting bigger. There's kind of a rotation that's occurring subtly over time, and when that rotation occurs, it actually drags down some of the soft tissue with the bony changes that are occurring. The muscles also can become a little lax. And there's other suspensory ligaments over here in the corners of our eyes and the inner corners of our eyes that can become more lax as well, and sometimes that leads to sagging of the lower lid as well. Each one of these components has to be addressed in order to correct and reverse the signs of aging. So now let's get into treatment options. A non-surgical treatment option to begin with is very simple. You can use sunscreens. Sunscreens, yeah, because the sun is causing the elastosis of the lower eyelid and it's causing some sagging of the skin. So that's a very simple preventive measure to kind of ward off aging in a sense. And it's never too late to start sunscreens, even if you have some changes there, and that will prevent even skin cancers there. So that's one thing. The second thing is something that's called Plexaderm, and I have no commercial relationship with this company, but it is a substance that is made out of clay, shale, and a sodium silicate, which causes a kind of a barrier effect on the lower lid, and is really a very temporary solution for lower eyelid bags. It's something that you might want to put on, say you're going out on a Saturday night and you don't want to have bags on your lower lids and you don't want to have any surgery or injections or anything else. That's something you might want to consider, and you just apply it to the lower lids, and according to the company, it can last up to 10 hours. I don't know if that's true or not, because it may kind of dries out and may not work quite that long. But anyway, some people swear by it. But that's only a temporary treatment. It's not really a good solution long-term or for any really length of time. Another non-surgical option, of course, would be to use eyelid fillers of hyaluronic acid gel type fillers like Restylane or RHA fillers. Now, why would we use fillers? Fillers are used so we fill in the hollows, the volume loss that occurs with age, and we're trying to recreate that continuity between the lower eyelid and the cheek, and we're trying to do it in a non-surgical, non-invasive way that's easy, convenient, right off the shelf, and is safe. And the safety has to do with also the way it's injected. It has to be injected with, I believe, a blunt cannula, not a sharp needle. And by the way, you can check out my video on lower eyelid fillers for more detail. But in general, I use blunt cannulas because they're safer, and I use small quantities of injectable, and I don't overinflate the area, and we get very nice improvement with immediate gratification. And that's the value of fillers versus some other approach. Now, the downside of a filler, of course, is that it doesn't last forever. It has to be repeated between 6 months to 18 months. And I find that most of the lower eyelid fillers last at least a year and a little more, but sometimes less depending on the person. Some people metabolize it more quickly. Now, if we want a more permanent approach to filling and volume loss, I would say we should consider using fat. And fat is to me the gold standard in terms of filling in volume. And the fat is usually taken from the abdomen, the hip, the inner thigh, the outer thigh. And I take that fat, we spin it down, we process it, and we use small amounts of fat in a deep layer or sometimes multiple layers of the lower lid, and very small and very strategically placed. Again, it creates this smooth transition from the lower eyelid to the cheek, and there have been improvements in techniques over the many years, and we get consistently good results with fat. So fat is certainly something that we should consider at the time of doing what I call a non-invasive procedure, even though it is somewhat semi-invasive in terms of having to obtain fat from one place and transplant it to another place on our body. But because it's from your own body, it doesn't have the same negative effects of taking something that's foreign and putting it in your face. So there are certainly some positives about that. Another non-surgical option that I recommend is to use lasers. And lasers can remove the top layer of the skin. They resurface the skin so that if you started out with deep lines and wrinkles, we can smooth out those lines and wrinkles with a laser. You can use either an erbium laser or a carbon dioxide laser. I prefer an erbium laser. I find that I get better final results with that without a lot of downtime. So I find that there's long-term improvement. Some of the wrinkles are going to come back. Certainly some of the dynamic wrinkles may come back, which mean when the muscle contracts, there's some lines and wrinkles that occur, and those can be mitigated with the injection of Botox as well. And so there are many little steps involved to achieve the best results. So finally, let's talk about the more permanent approach to fixing lower eyelid aging and bags. And here I use a very customized approach to deciding what kind of approach I'm taking, because everybody is a little different. And some people require fat excision, fat removal, and sometimes even fat transposition. Sometimes there's fat that we see that's protruding above the lid cheek junction, and we remove that fat into those grooves and use that fat as a filler, a natural filler that's attached to a blood supply. However, very often I will remove the fat that's protruding and actually replace some of the fat that has to be filled into some of the hollows around the eye, because the amount of fat that I can move from one spot to another is inadequate. It's not enough. So therefore I have to get fat from somewhere else. And the fat is usually obtained either from the belly, from the hip, or the inner thigh. And that fat is processed in a very specific way, then injected under the skin and deep below the skin in different layers in order to get a smooth transition from the lower eyelid to the cheek. And again, we're trying to always recreate that lid cheek junction and try to make it disappear with the manipulations we perform. There's also some people who have some laxity of the lower lids and they're sagging, and they need to have these canthal tendons tightened. Some people will shy away from doing that, but sometimes that's a preventive step so that post-operatively the patient doesn't get sagging of the lower lid itself. So sometimes we have to tighten the lateral canthi, we call it, okay? And as I previously mentioned, laser resurfacing is also added onto this picture, because there can be some laxity of the skin associated with the bulges of fat that we see. So we then use laser resurfacing as well to smooth out the wrinkles and fine lines. If you're considering non-surgical or surgical options to treat your lower eyelids, the best people to do that are oculoplastic surgeons. I happen to be an oculoplastic surgeon, and I've been in practice for over 30 years. I've seen all the permutations that may arise in the lower lid. So if you want your best results and the safest option, choose an oculoplastic surgeon. That's the way to go. I hope you found this video to be informative and helpful. If you have any further questions, please leave them below. Please subscribe to the channel. I look forward to interacting with you in the future, and I look forward to seeing you again in my next video.